Do I have your consent to record?
Yes.
Okay, first I'm going to perform hand hygiene. Hello, my name is Alice and I will be your nurse today. What is your full name and birthday?
John Brown. My full birthday is October 21st, 1957.
Okay, and his ID card matches what he says. Okay, what are you here for today?
Checkup.
Do you have any problems?
No.
Do you have any pain?
No.
Do you have a family history of head, ears, eyes, nose, or throat problems?
No.
Okay, that's good. Okay, now I'm going to check his vital signs. I'm going to take an oral thermometer and a pulse ox. And I'm going to check his oxygen, heart rate, and I'm going to check his oral temperature under his tongue. And he's closed his mouth. And beep. And then I got his oral temperature, and it's between 98 and 96. 98.6 Fahrenheit is normal. And his oxygen is 98%, which is over 95%, which is normal. And his heart rate is 56. And normal heart rate is between 60 to 100. And so 56 is a little lower, so that can still be normal. Next, I'm going to take his radial pulse for 15 seconds. And his respiratory rate. Okay. And his was 5, so times 4 is 20 respirations per minute, and his heart rate times 4, 14 times 4 is 56 beats per minute. And if I was to actually take his heart rate and not just his radial pulse, and his pulse is 56 beats per minute. Okay, it'd be in the left side in his mid-clavicular line in the 5th intercostal space. Okay, and I will take his blood pressure. Okay. It'd be on his brachial artery, and I will pump it up 20 to 30 pressure past where I stop hearing the brachial artery. Okay, so he's 135 over 85. So he has hypertension type 1. And normal would be under 120 for systolic and under 80 for diastolic. Okay. Yeah. And that's all for vital signs. And now I'm going to palpate his temporal artery. Okay. So the rhythm is regular, and it's +1 out of 4 for temporal artery. And for carotid artery, you do it one at a time, and it's regular and +2 out of 4 in strength, which is regular strength, and +1 is diminished strength. And the rhythm is regular. And now I would auscultate the temporal artery. And there's no whooshing, which is normal. And now can you breathe in, breathe out, and hold. Okay, and there's no whooshing on his carotid artery, which is normal. And so no brutes. And I'll do that on the other side too. Okay, now I'm going to inspect his face. It's symmetrical, no redness, no swelling. His ears are symmetrical. His neck is symmetrical. Lift your neck. Neck is symmetrical. Can you swallow? It moves up, which is normal. I'm gonna look at the back of his neck. It's also even. And I'm gonna palpate his trachea. Okay, normal. I'm gonna palpate his thyroid gland. Also normal. And no weird bumps. Okay. And now I'm going to palpate his frontal sinuses. Any pain?
No.
And maxillary sinuses.
No.
Any pain? Okay, I'm gonna palpate his nose. I'm gonna palpate his eyebrows and eyelids for the lacrimal apparatus. And there's no swelling. No swelling on the forehead either. All normal. No pain. No tenderness. Is there no tenderness?
No.
Okay. And now I'm gonna palpate his ears. And if it doesn't feel hard, too soft, and I'm gonna look at the back of the ears, normal. Okay. I'm gonna test for nasal patency. Breathe out. Breathe out. Okay. So now I'm going to inspect his skull and scalp. Okay. And there's like some balding in the crown of his head in the back. And okay. Now I'm going to palpate his lips. Normal. Okay. Now his sclera is white and even on both sides. I'm gonna pull his eyelids down. His conjunctiva is pink, which is normal. And now I'm gonna invert his eyelids. Okay. And they're also pink, which is normal. Okay. And his pupils are round and symmetrical on both sides. Okay. Now I'm going to inspect his ear. And it's the same color, and he does not have a Darwin's tubercle because his helix is normal. And now I'm gonna tilt his head back and look up his nose, and he has normal sized turbinates. It's a normal pink color in his nose, no discharge, no deviated septum, and like no holes or anything in the septum. Okay. Okay, and now I'm going to assess his mouth. Okay, say ah. Okay, and his uvula moves up. Do you have tonsils?
No.
Okay, no tonsils.
No.
Okay, and yeah, did it get removed?
Yeah.
Okay, now I'm gonna look in all between his gums and up. Lift the tongue. Okay, and under looks normal. Okay, his tongue and under his tongue looks normal. Hard palate. His hard palate is hard, which is normal. And yeah, and his uvula moved up, which is normal. No tonsils. Okay. Now I'm gonna test for gag reflex. I'm gonna put the stick behind his uvula.
Oh.
Okay, he gagged, which is normal. And now stick out your tongue. Say light, tight, dynamite.
Light type diamond knife.
Light, tight, dynamite.
Light type diamond knife.
Okay. He can say it. So his cranial nerve 12 is intact. Okay. Now I'm going to test the strength of his head. Push, 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 push. Test the strength, push, push. Okay. Look to the right. Look to the left. Oh shoot. Look to the right. Okay. Okay. Yeah. So look down. Up. Okay. All normal. Okay. So yeah. Turn your right ear to right shoulder. Left ear to left shoulder. Okay, that's normal. Okay. Yeah. So shoulder head, shrug. Okay. Okay. Yeah. Normal. So the strength and range of motion of his head and neck and his chin and his shoulders are normal. Okay, now I'm going to do his lymph nodes. Preauricular, postauricular, occipital, tonsillar, submandibular, submental, and a posterior cervical, anterior cervical, supraclavicular, infraclavicular. Okay, and I don't feel anything, which is normal. Okay, now stand up. Okay, okay, I'm gonna do the whisper test. Behind him, okay. Okay, I'm gonna stand 2 feet behind him and whisper. Oh, wait, okay. He needs to block his ear on one side. Okay. I'm gonna say,
Garden dog flower.
okay. So his is normal, and I'll test the other side. And now I'm gonna do the Romberg's test, and it's gonna test his balance, and that's controlled by the ear. And he's gonna put his arms outside, close his eyes, and he would have to balance for 20 seconds. Okay, now I'm gonna do the Snellen's test of visual acuity and a test of nearsightedness. He would block one of the eyes 20 feet away, and he would say the letter down to the lowest, and he can miss up to 2 on that one line and still have normal vision on that line. Okay, now sit down. Okay, I am going to test his the constriction of his eyes. So when I shine a light in one eye, both pupils should constrict. Okay, they both constricted it, and that's normal. Okay, now I'm going to perform accommodation test. So when I get close, okay, the pupils constrict and his eyes converge. So he has all of his his pupils are round and even, and they react to light and accommodation. Okay, so now I'm going to do the corneal light reflex test. Stay at this light. Okay, and the white part right of the light reflecting back in the pupil is the same on both sides. Okay, now I'm going to do the corneal blink reflex test. And I'm going to try to touch his cornea. Okay, and he blinks, which is normal. Okay, so now I'm going to do the 6 cardinal fields of gaze. Keep your head straight, looking at me, only move your eyes. Okay, and his eyes were not shaking, and it was smooth, which means and this test for his extraocular eye muscles, which means they're normal. So now I'm going to do the kinetic confirmation test, which tests visual fields. Okay, cover your right. I'm going to do this now. And you say yes when you see it.
Yes.
Wait. You say yes when you see it.
Yes. Yes. Yes.
No, wait. You have to stare your eye at me and do not move. At that eye and do not move.
Yes. 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 Yes.
Okay. And yeah, in summary, and that's all.